We just got done talking about constipation and laxatives. Now we're going to talk about the totally opposite problem, diarrhea, abdominal pain, and spasms, and drugs that take care of those. And of course, these include the anticholinergics. You can't get away from them no matter what body system you get into. So motility refers to the spontaneous but unconscious or involuntary movement of food through the GI tract. Luckily, we don't have to think about it. We just eat and our bodies do the rest. However, sometimes, like it can go too slow, it can go too fast. And when that happens, increased motility can lead to cramping, bloating, pain. And we can get that just from a minor gastritis, GI bug. It's not right to say stomach flu. There's no such thing as the stomach flu. It is indeed caused by a virus, but it's not the influenza virus. Influenza is a respiratory disease. So when someone tells you they have just, a touch of the stomach flu, it's like, no, you don't. But anyway, usually it is caused by a virus. And generally you'll see diarrhea, increased gas. However, you can have diseases that are chronic and bother you your whole life, like ulcerative colitis, Crohn's disease, conditions like that. So we are going to be talking about different classes of anticholinergics, antispasmodics, and antidiarrheals. So we have to go backwards to page 257, table 13.3, and that talks about some of the different drugs you'd find for these conditions. So we know that anticholinergics slow down intestinal motility. Acetylcholine or cholinergic activity encourages that feeding and digesting process. Anticholinergics, anything that blocks acetylcholine, is going to work against that. So anticholinergics or antispasmodic preparations reduce cramping, intestinal motility, which also in turn decreases acid production and movement of the stomach. And so that helps get rid of pain. When the GI tract knows that it's moving too quickly, the stomach's first action is, we're, really quickly moving something through the GI tract. We need more acid. And so they're going to increase acid production, which can also increase the irritation that the person is having. So for people who have ulcers of the GI tract, pylorospasm, where you've got the pyloric sphincter cramping up, biliary colic, which is the official name of the pain you get when your gallbladder is not working right, or your pancreas, hypermotility, irritable colon, and acute pancreatitis. Those dogs, I'm going to kill them. Antidiarrheal medications reduce the fluid content of the stool. That cuts down on peristalsis, cuts down on motility of the GI tract. It also increases smooth muscle tone, so things act more normally, and it cut down on secretions. So that helps with diarrhea where we're not really sure what's causing it, or diarrhea caused by antibiotics. And some antibiotics will cause pretty severe diarrhea. You know what's causing it. You don't necessarily have to stop taking the antibiotic, but you might want to take a medication to cut down on the diarrhea. The adverse reactions are going to be your anticholinergic reactions due to the high dosages of the anticholinergics. Everything that anticholinergics cause, blurred vision, dry mouth, urinary retention, increased blood pressure, increased heart rate, they're going to be caused because of taking these medications. And antidiarrheals can cause side effects as well. Now, the new GI stimulants, we talked about metoclopramide or Reglan. If you combine them with other drugs that affect that cytochrome P450 system, you can get cardiac dysrhythmias. So many of these anticholinergics don't mix well with a drug like Reglan. You could end up with cardiac problems. For patient teaching, you're going to do your regular nursing process, evaluating and assessing the patient using history and physical, coming to a diagnosis, which is usually going to be education. You're going to plan how these meds should be given, plan what nursing interventions you need, and of course you want to evaluate. Have the patient's cramps ceased? Are they, passing firmer stools? On page 259, we see a memory jogger. And it talks about not necessarily stopping diarrhea routinely. If we know it's from a medication like an antibiotic, it's okay to stop it. But if you've got some sort of an infectious process, gastritis, or, heaven forbid, something like salmonella, you don't want to stop that diarrhea. You want that infectious material to pass out of the body. So what we do is just try to give supportive care until the illness passes. The brat diet, bananas, rice, applesauce, tea and toast, plenty of fluids. In children, you don't want to wait too long to let diarrhea go by. They can get dehydrated in less than 24 hours. Adults usually don't let 2 days go by if the person isn't able to keep in fluids. They might need fluid, IV fluids and electrolytes, but mostly supportive care until the illness passes. And that's it for chapter 13. So listen to your lectures while you are watching the PowerPoint, and we will have our test over this in a week or so. Thank you.